Xylitol Toxicosis. Xylitol is a 5-carbon sugar alcohol commonly used as a sweetener in sugar-free products, like chewing gum, candy, toothpaste, and baked goods. Dogs are the only species known to experience xylitol toxicosis. How does that happen? When ingested, xylitol very quickly and very potently stimulates the secretion of insulin from the pancreas, and lots of it. Insulin is a hormone that functions to reduce the levels of glucose in the blood. It does this by binding to insulin receptors of cells like hepatocytes, adipocytes, muscle cells, and many more, allowing glucose transporters to transport glucose from the blood into the cell. When there's too little glucose in the blood, we get hypoglycemia. Hypo meaning low, glyce referring to sugar or glucose, and emia meaning presence in blood. Low glucose presence in blood. On top of that, insulin also increases the activity of sodium-potassium ATPase pumps on the cell membrane, bringing potassium ions into the cell, decreasing the levels in the blood. This is known as hypokalemia. You can tell what the word means now. Now, potassium is important in maintaining the cell's resting membrane potential. With hypokalemia, this becomes hyperpolarized, and muscle cells become less reactive to stimuli. Both hypoglycemia and hypokalemia contribute to muscle weakness and lethargy in the patient. But what happens when the brain, an organ that exclusively relies on glucose for energy, can't get enough glucose? You can have seizures, and the patient may fall unconscious and go into a coma. A dose of over 75 to 100 milligrams of xylitol per kilogram of body weight can cause profound hypoglycemia. And a dose of greater than 500 milligrams per kilogram is even worse, because in addition to the clinical signs mentioned, there may also be severe hepatic injury that may lead to liver failure. The mechanisms of hepatic injury are unclear. The two proposed mechanisms, however, are 1. Depletion of cellular ADP, ATP, and inorganic phosphorus molecules in hepatocytes, the loss of energy in the cell, leading to cell death, and 2. The production of reactive oxygen species in the liver. Regardless, the clinical signs of liver injury may take longer to surface. These signs include vomiting, elevated ALT, AST, and total bilirubin, jaundice or icterus, and coagulopathies, because the liver is responsible for metabolizing bilirubin and making clotting factors. Patients are at a greater risk if they have pre-existing liver diseases or pre-existing conditions that predispose to hypoglycemia, such as insulinoma or type 1 diabetes mellitus. Treatment. There is no antidote for xylitol toxicosis. Early aggressive veterinary intervention is needed to avoid possible life-threatening consequences. Xylitol is rapidly absorbed, and clinical signs can occur as quickly as 30 minutes after ingestion. Treatment involves decontamination, supportive care, and monitoring. emesis should be induced, but only for asymptomatic dogs because of the risk of aspiration pneumonia. Like if they're unconscious, they could inhale the stuff that they're vomiting out, so yeah. Activated charcoal does not bind to xylitol, or at the very least does so very poorly, and thus is not recommended. Dextrose supplementation should be given to manage hypoglycemia. This can be in intravenous boluses and/or concentrate infusions. The latter is given to prevent hypoglycemia, even if normoglycemic at presentation. The former is given if blood glucose drops suddenly. This should be continued until the patient can maintain normal blood glucose levels. Speaking of blood glucose levels, this should be monitored every 1 to 2 hours. If the patient is not vomiting, meals can be offered to supply glucose orally. For liver injury, hepatoprotectants like S-adenosylmethionine, silymarin, and N-acetylcysteine are recommended. Fresh frozen plasma can be given for DIC or coagulopathy. Prognosis. Prognosis is good for patients with uncomplicated hypoglycemia. But prognosis is guarded for patients with liver failure. Prevention. As with most poisonings, prevent access to xylitol-containing products.